Hello, everybody. My name is Dr. Nnenna Ananaba, and I'll be presenting this study with Dr. Pamela Mukari. The study evaluated the impact of nutrition on education among secondary school students in Uganda. Uganda is a low-income country located in East Africa with an estimated population of about 44 million people. The per capita income is estimated at about $1,800. Our population of interest is also estimated at about 34% of the total population. And we're interested in this population because data reports enormous gaps remain among children and adolescents who are still dying from preventable causes, including malnutrition. According to data reported by the United Nations Population Fund, about 10% of young males aged 10 to 24 are currently heading households. About 38% of young people live in the two poorest wealth quintiles. About 19% of young people live in households where the head of household has no education. Furthermore, 22% of adolescents have left school, and about 8.8 million young people are not engaged in education, employment, or any form of training. A public health burden that is of concern to us is that an estimated 23% of children are currently out of school in Uganda, and 29% of girls aged 15 and above struggle to read and write. Some of the known fact some of the known effects of poor adolescent nutrition include cognitive health, social impacts, mental and behavioral health, physical health, diseases and health as a whole, and education. And our interest is really on the education. The Budging Project reported an estimated 133,000 Ugandan children had to repeat grades every year. The Ugandan government also released a statement in 2013 and noted that when a child is undernourished, that child's brain is less likely to develop at healthy rates, and that child is more likely to have cognitive delays. Children in poverty have even less a chance of getting out of poverty if they do not get an education. And so, to our study was a cross sectional study, and we sampled 250 adolescents aged 10 to 24 across three secondary schools. We present results from descriptive and qualitative analysis. This table shows a distribution of the sample, and we see distribution across age, gender, educational grades, and head of households. Some of our significant results include the fact that the results actually did vary from school to school. Majority of students in boarding school reported having access to breakfast as compared to those in day schools, and 63% of those students in day schools reported not eating breakfast at home. Only about 10% of participants reported receiving nutrition education activities outside of the classroom, and only about 14% reported having access to nutritional screening assessments, nutritional care, and referrals through their school. Students, when they were asked about problems related to limited access to meals, reported having issues with difficulty in concentration. That was about 56% of them, and not doing well academically. A greater proportion of students also reported worrying about their food sources. About 60% reported that they believed that their dietary needs were not well met and that it would impact their education. So even though this study was a descriptive study with a small sample size, the reports pointed to the fact that limited access to at-school meals revealed unhealthy eating habits. We therefore recommend that continued support to sustain school programs is imperative in reversing this trend. Interventions that address the known factors as exacerbating poor adolescent nutrition are also needed in Uganda. Here are some of the references to this presentation. Thank you.